Hi, my name is Dr. Foo Chek Siang. I'm a gastrointestinal surgeon practicing in Mount Elizabeth Novena Hospital. I've been here for the past 13 years. The Mickey is basically used for patients who need long-term tube feeding. The options are either to put a nasogastric tube, which is a long tube which goes through the nose into the stomach. But of course, in long-term feeding, we will prefer very much to do a PEG, which is through the tummy into the stomach with a conventional tube, which Evernorth also makes, and that looks something like this. But the Mickey is an improved version of this, where there's a lower profile tube which sits just snug onto the skin instead of sticking out completely as such. And so there's a much lower profile on the skin above, right? So basically, in short, the Mickey is used for any kind of patients who need a long-term tube feeding. Mickey has made a big difference in a subset of patients who need long-term tube feeding, particularly those patients who are awake and mobile and have an active lifestyle. Because you see, the very simple fact is that for tube feeding, there's a tube which sticks out, and sometimes it can cause a little bit of obstruction to the clothes, and patients might not feel very confident about going out with the tube sticking out. Certainly from the nose, the PEG tube is already an improvement because it hides underneath the skin. But in an active individual, having less stuff outside the skin is certainly better. And so the Mickey, what the Mickey offers is that it's just a very low profile tube, which doesn't snag on clothes, and it gives some confidence of being fully active and fully mobile, especially for patients who are walking around and who love going out. And although they're not able to take everything orally, they'll be able to supplement everything through this Mickey tube. The PEG is actually indicated for any kind of patients who need a long-term nasogastric tube feeding, and typically we see this in patients who have got a stroke, have got upper esophageal diseases, or have basically just anybody who needs additional supplementation. And so in patients who need a longer-term nasogastric tube, we normally suggest that they undergo a PEG tube, which is typically about this one, right? The longer kind of tube which sticks out through the tummy like this. And so in certain patients, I will also encourage them to consider the low profile Mickey tube, which is basically this tube in two sections, but just that the part which sticks out is a lot smaller. Now, in an Asian context, unfortunately, a lot of patients who are on long-term NG tubes, they really don't want to rock the boat, and they are happy doing that. But we know that there are definitely advantages in a PEG tube versus an NG tube. One of the main advantages is that it does not encourage aspiration pneumonia, which is a major problem with patients with NG tube. Now, what aspiration pneumonia is that when they feed, the milk in the stomach basically backflows up the esophagus and into the lungs, and this can be potentially fatal in acute circumstances. Now, the PEG tube and the Mickey tube does not encourage aspiration, so it's a very good option for patients who really need NG tubes. And so far, for the patients of mine who have transited from NG tube feeding to PEG feeding, they are always very happy, and they say that, oh wow, how come I didn't know about this earlier? A considered decision to make the jump into a PEG tube, and certainly all of them are actually very, very happy. Mickey has certainly enhanced the varieties of tube I can offer my patients, and it basically gives them a lot more options. And for most patients, I would push them towards using a Mickey because it's a lot more convenient. Even for those patients who are not active and those who are bedbound, sometimes the patients really appreciate, the patient's relatives actually and caregivers appreciate the ability to have a low profile tube, so that those patients who are a bit less aware will be less prone to dislodging the tube accidentally if they happen to scratch the tummy or whatsoever. I can certainly recall a 100-year-old patient of mine with swallowing difficulties. He wasn't eating enough. He was having aspiration pneumonia, which is where the condition where because his swallowing wasn't perfect, whatever he used to eat used to go into the airways and cause pneumonia, rather because it didn't go down the right airway. So I put in a PEG, a Mickey for him, and he's being kept by his whole team of nurses, and they are all very happy and very satisfied with this because he still goes out on a wheelchair and he doesn't have a tube sticking out. He's a lot more comfortable with a Mickey low profile tube, and yet and through the months I follow him up after a Mickey, he actually managed to gain weight, and that's definitely a success story. Compared to other methods of insertion, the Mickey takes a few more minutes to insert, but certainly even when it takes a few minutes more to insert, the outcomes are so much better that it's really, really worthwhile. And so the insertion any more difficult or any more complicated, and so I think it compares very favorably towards the other insertion techniques. I think healthcare providers generally know about the existence of PEG tubes, which is a conventional tube, but not everyone actually knows about the existence of low-profile Mickey tube. So I think that exposure could be better. More patients would need to know, more healthcare providers would need to know, even sometimes not just doctors, but certainly the periclinical staff, the nursing staff, home care staff are all always very important when it comes to influencing decisions on what kind of tube you put in, because they are the ones who actually take care of the patient. They will definitely see a benefit in having a lower profile tube. So I think that the target audience should be the nursing staff and the healthcare assistants who take care of patients.